Hello. Chronic obstructive pulmonary disease, or COPD, is a common cause of breathing problems. There is no single test for COPD. Instead, making a diagnosis is based on a combination of history, examination, and investigation findings. If your doctor or nurse suspects that you might have COPD, they will take a detailed history of your symptoms. Symptoms are the features of your illness that you notice, such as shortness of breath. They will want to know what breathing problems you have, including what makes your symptoms worse and how your symptoms affect your everyday life. You'll be asked about your health in general, as well as any history of smoking. Your doctor or nurse may ask you questions that you do not think are related to your breathing, but it is important that we rule out other medical conditions. During the examination, the doctor or nurse will listen to your lungs with a stethoscope and check the amount of oxygen in your blood by putting a small plastic probe onto the end of your finger. This is called your oxygen saturation level. It is likely that they will also measure your body mass index, or BMI. You may be sent for a breathing test called spirometry, either at your GP surgery or in the hospital. This is where you're asked to blow into a machine that can measure the capacity of your lungs and calculate how quickly you're able to empty your lungs of air. These measurements help us to understand how wide or narrow your airways are. In COPD, the airways are narrowed, which is different to other lung conditions. There are some other tests that your GP may request. These include blood tests and a chest X-ray. The reason for doing these tests is to rule out any other causes of your symptoms. For example, a chest X-ray may show a chest infection, which could explain your shortness of breath. Similarly, a blood test might show that your iron levels are low, which is another common cause of shortness of breath. After a diagnosis of COPD has been made, your doctor or nurse is likely to start some treatment to help improve your symptoms. Occasionally, you may be referred to see a specialist doctor who may want to do further tests and arrange treatment for you. If you have any questions about being diagnosed with COPD, please speak to your GP or practice nurse.